Good evening and a warm welcome to our panelists and to our YouTube viewers. On today's panel, we will be discussing the impacts of COVID-19 on migrant communities in the north of England and the UK more broadly, and how this has highlighted and exacerbated the existing and worsening inequalities they face. The government policies rolled out during the height of the COVID pandemic caused shockwaves across communities all over the UK. It is well documented that there were groups which benefited from some of these changes, while some suffered. But the severity of suffering faced by various underserved communities in particular was arguably down to a series of political choices by the government. Amidst the vast array of economic and social impacts caused by the pandemic, strict immigration policies had left many migrants without support, leaving them vulnerable to the risk of absolute poverty and even destitution. Typically occupying lower wage jobs, migrants who have managed to secure employment are often placed in precarious positions and are largely exposed to COVID-19 compared to those of higher levels of income and consequentially better health outcomes. The impact of the pandemic on migrants has also impacted their ability to interact with the economy in its current state. With minimal economic migration flows in and out of the UK, many businesses and sectors have been seriously affected, as migrants constitute a substantial portion of the UK's workforce. With levels of migration being concentrated in inner cities, COVID is likely to have a serious impact on these individuals and the communities they settle into. And so this dialogue panel will explore both the impacts COVID-19 has had on migrants and migration, as well as how communities in the north of England and the UK more broadly can come together to overcome the difficulties enhanced by government policies, media representations, and other important structural factors. In dialogue today, I will be joined by a very interesting panel of diverse voices. First, we have Ali Mahgoub, who is director of Leeds Refugee Forum, a community organisation that was very busy during the pandemic. The LRF offers practical support for refugees and asylum seekers through education, advice, information dissemination, and social activities, as well as creating a space where refugees and the communities they belong to can meet and find mutual support. Next, we have Hakk Ozal, who works as a project coordinator at Bevan Healthcare. Hakk will be telling us a bit about his story as a Turkish migrant to the UK fleeing political persecution in Turkey during the pandemic, and how he navigated the system to access basic needs and his community, the Hizmet community, during the rollout of the government's hostile environment policies. And lastly, we have Dr. Jess Potter. She's an NHS consultant in respiratory medicine, a public health researcher, and an activist. Her research focuses on access to healthcare and the structural conditions that shape these experiences. During the COVID-19 pandemic, she worked both in a large intensive care unit in London and as a respiratory consultant in a busy North London hospital, where she is now clinical lead of the tuberculosis service. Jess campaigns for the right to health for all, with a number of grassroots organisations, including Docs Not Cops. And she has spoken about these issues on television and radio and written extensively in the national and international press. In 2019, Jess was recognised for her contribution to the Patients Not Passports campaign and at the Women on the Move Awards by the UNHCR and Migrants Organised. My name is Cheriesse Bema-Kwakye, and I am a research fellow and project coordinator at the Dialogue Society, and I'll be chairing this discussion. Thank you again to our audience for joining us, and we look forward to hearing your questions and contributions. And please do get those ready and share it with us over the course of this session in the chat function on YouTube. And I will now hand over to Ali.
I think he's muted.
I'm sorry for that. I'm Ali, and I'm working with an organization called Leeds Refugee Forum. The forum is founded in 2003 as an initiative from refugee community leaders bringing themselves together to create a strong voice for the refugees. During the pandemic, or when they started in 2019, we thought this is a big problem, and there will be a big impact on our people, because we think the most important thing, how we can start from the start to bring these communities together, doing some work to support themselves. Because the forum and the structure of the forum is mainly working on how we can let these people be a part of any issue to be resolved. So we start bringing these communities together. At the same time, we try to work closely with NHS, the government COVID advice website, and voluntary action Leeds. This is a big organization commissioned to support small groups. And at that time, the Leeds City Council also start bringing these communities together, how they can do some work during this lockdown. So the Forum Central started bringing all these people together, and what they called allyship program, and that is as also initiative from the start from Health and Wellbeing Board for Leeds City Council. So what we do, we start, what we did, we start, and it's still doing the same, we start bringing the refugee community organizations together. And at that time, it is difficult because the restrictions of the COVID, and people scary about how that will be and how we can bring people together. But we start adapt our works and the facilities that we can use. And as you know, everyone is new how to use the media, and what the barriers around is many people that are not accustomed or familiar with using these applications like Zoom, Microsoft Teams, everything like that. So we start with, at the beginning, with teaching these people how they can be connected and using these facilities just to send messages to the leaders and how they can reach their community members. So the forum at that time started as one step hub for dissemination, the information, and working with people in a multi-bilingual or bilingual groups, because we know the problem is the barrier, or the big barrier of the language for most of these groups. So at the same time, there's a lack of knowledge of using applications and how they can access the services, and everything is locked for these people, and how they can do any work together to reach these vulnerable groups, and how they can use any facilities that within the projects around the difficult areas or more poverty areas in Leeds. So we create these small groups. So we start doing focus groups. We start bringing small groups speaking the same language. We use a lot of volunteers from the same groups, how they can reach the people, because we think this is the right people to send these messages. And at that time, there is a lot of difficulties understanding the right messages, sending from Refugee or that organization that can be sending the key messages and the right messages. A lot of problems because people getting some information from their own network through WhatsApp, through YouTube, and other things, and there's a lot of issues around even how they can keep themselves safe. And to be honest, at that time, there is no any other support for these people. They got locked, totally locked, no information, no any surgeries, no any help that can be reached by these people. So we start doing more work with other organizations and the third sector because we think that's there may be the useful way of getting around the difficulties on doing this stuff. So we work with other people from the same community. We create different groups and we contact the local authorities looking for some support. Fortunately, we got some support from the city council. They have some projects around giving more equipments, laptops, tablets, or they have what they call a scheme for supporting and lending people following these equipments, they can be supported. And another problem that also is a big issue for these groups because most of them, they lost their jobs and they can't afford doing any other income, so they can buy or any credit for the using this media. So we get some support from what they called digital scheme, and they got some data for using this equipment. The other thing is also we try to work with other organizations, not only for about focusing group, but highlighting the main issues to these groups and especially vulnerable elderly people and single mothers and also people they don't have any connections with any other support groups. And they are facing a lot of issues. We have domestic violence issues. We got it, and we also, for example, we put our number in the office because we can't work from the office in person. So we got a lot of calls. So we come over this with getting some support from some funding or grants. We create a phone line supporting these people. The phone line, we ask people to still tell their names and the language they speak and and the number they call from. And we got a lot of volunteers from these groups speaking different languages, talking to these people and signposting them to different services that across the city, they maybe get help. The main things that we face in that side, people, they're not accustomed to use these services. And even sometimes if they called for any help, they wait a long time in the line just to get someone talk to them, and even the language is not that clear for them to understand what are they asking for and how they can be supported, all these issues. And the other things now is still we're working on. There's a lot of jobs. A lot of people lost in their jobs. We're trying still up to now getting some support for these people in employment skills, finding jobs, but it is a difficult problem. So I think because the government decided 10 years ago, and it's still suffering from this, these people that are not in need of a special support or special advisory organizations or advice. So they still facing a lot of problems of finding jobs, learning the language, and find themselves in building the network or finding any other support from the local authorities or from other organizations because the cuts for the funding, all these problems now, we feel the people is getting more stuck on doing anything. So this is one of the problem. If I'm talking about different issues, there's a lot of issues now around mental health issues, and still there is no any other direct support on these issues because the language, the culture, using the service is a big problem, and still I think it should be more effort on supporting these people. This is in general why I can't explain the impact or the direct impact from the pandemic or the COVID-19 with these people. Thank you.
Thank you so much, Ali, for contributing and speaking to us about the evolution of your work as an organization and also the operational challenges you faced. It was interesting to hear how you collaborated with other organizations to reach more marginalized migrant families and communities to help them restore their social capital and also access employment advice, as well as justice where their rights had been denied. So thank you very much for your contribution. And we will now hear from Hakk.
Hi, can you hear me, Cheriesse?
Yes.
Perfect. Yeah, so firstly, thank you very much for having me today. It is a really honor and privilege to be with you today. I think it is also excited to be in a meaningful panel today evening at Dialogue Society's online platform. So let me start with introducing myself. So I'm Hakk. I'm original from Turkey, and in 2007 I left Turkey to Southeast Asia, one of the Southeast Asian countries. So I was living in Laos, in the middle of 5 enormous countries like China, Vietnam, Thailand, Myanmar, and Cambodia. So it's just tiny, small country. Well, I never imagined, or I never thought that I will be one day asylum seeker or refugee. Well, I'm not refugee status yet, but I'm still asylum seeker. So, my first encounter with an asylum word was in 2015, when the military coup happened in Turkey. Despite the fact that I wasn't in Turkey for last 11, 12 years, I was accused with the military coup. So in 2015, by the way, I was working in an international school there. So then in 2015, when my passport is, getting to expire, so I just wanted to, renew it as my normal human rights. So I went to the Turkish mission in Thailand because there was no, embassy in Laos. So they just denied my request because they asked me to go back to Turkey, which the persecution started in Turkey then. So I was afraid to go back to Turkey because of my life danger and my family's life insurance. So then I found myself in the UK in 2019 in October at 8 a.m. in the morning. So I was in Heathrow airport. So it was my first time to be in the UK. So just talk with the police immigration that I was, seeking an asylum and seeking a safer place for myself and for my family. But for some reason, my family couldn't come along with me because I had to make an urgent emergency departure from Laos. So then, my asylum life journey then started in London in 2019. I just stayed in a hostel in London for about a month, and then I was accommodated in West Yorkshire by then I was always thinking that I think that I was, I thought that I understood, I know English basically. However, the accents, especially Yorkshire accent, was a bit, challenging for me. But I get used with the people here in Yorkshire, especially Yorkshire pudding and wonderful British tea with milk. Yeah, so we had a family reunion because my family couldn't come then. Then we had to wait like for about 1.5 months to be, in the same place together. So I think it was beginning of like February in 2020. We were accommodated in a house after staying like 4 to 5 months in the hostel or hotels. So the ambiguity, is always there. So you don't know where you're gonna go and where they're gonna take you, because you're an asylum seeker, basically. So finally, we were accommodated in a house in Bradford, where I live at the moment. Then outbreak just came out in March in 2020, I think. So, well, I can't really remember what happened in 2020 whole year, because I think everybody was just in the houses, in the indoor places. Nobody can really move outside, or they can't do anything they like. So as an asylum seeker, I didn't see much differences in my life, because mostly I was on an online platform, rather, trying to study by myself, or just trying to learn new things, because I was mainly new to the UK, and a new country, new place, new people. So yeah, it was basically it was all right for me, because I think that is the advantages of being in a pandemic, like just staying in a safe place and learning the things that you want to learn, and read the books that you haven't read, or you want to read, basically. So during the pandemic, well, I then started thinking about, like, I think being an asylum seeker in the UK is like an outdoor jail for me. After like 1.5 years, I started thinking of that, because you can't really go anywhere you like with a limited allowance, because you are just getting in like £40 weekly, which is just enough, barely enough for your food expenses. And it's been almost like 2.5 years that I'm living as an asylum seeker. So I am a human being. So I am not only looking for my food. Actually, so I need to buy something. So I think Home Office in this case is thinking a bit stingy, or I don't know the word really, but I think their budget is really limited for a family or for a person, basically. As far as I understand, I think they are just giving some message for people that, okay, the UK is not a place for asylum seekers. So if you're coming, you need to struggle, basically. So so another advantage that I think I get longer hair. So it was always my dream to get longer hair. Yeah, basically I got it. Yeah. So in the during the pandemic, for the first year, it just passed very quickly, and second year, I started, being a volunteer, even on the online platforms, like teaching English for asylum seekers or refugees in an online places, or being a befriender for those who need a friend, basically. So well, actually, in my place in Bradford, local organizations were really active, just creating some WhatsApp groups, or just reaching out us by just calling us. So it was really nice to see them. It was really nice that, you know, somebody is thinking of you, thinking of your family. They are even like bringing some like gifts or, you know, some necessary stuff when you need it. So they are just delivering to your home, even you can't go and get it. So there are wonderful people. Then yeah, and then because when you are an asylum seeker in your first year, so 12 months, you are not allowed to work. So you need to wait, you know, for 1 year to be eligible for working, basically. So that was a bit challenging for me because I had a really active life prior to coming to UK. However, it was a bit really hard because, as I told you, it was like outdoor jail. So I was just, you know, put in a box and couldn't do anything else. But then when like my first year just finished, then, you know, I got my work permit. I started applying jobs in Yorkshire. Then finally, you know, being like financially independent really helped my well-being, because after 1.5 years, like with a limited budget, it was really difficult. If it was like if I was on my own, I think it was all right to live really. But when you have a like family, you need to think about their, you know, other stuff because they just want to do something different, really. So being financially independent helped me physically and mentally better. And then finally, just I found myself in in one of the, you know, NHS organization where I was actually volunteering with them. And then things changed for me, really. Overall, you know, everybody, you know, struggle in this outbreak, and everybody had advantages or disadvantages. But for an asylum seeker, for me, nothing was really special. So I was not many things changed in my life, basically. But it was nice to, you know, I just spent some time volunteering. So I think volunteering also one of the things that helped me to, you know, to be better mentally. Yeah, so these are the things I wanna mention today. And also thank you again. And it's really interesting to listen, Ali. And also I'm looking forward to hearing from Jess now.
Thank you so much, Hakk, for sharing your journey of what it felt like to come to the UK at such a time. It was very reassuring to hear that your local community in Bradford did reach out and were very welcoming. But it was also very, very scary to hear that you felt like you were in an outdoor prison. I think those words really struck me and really helped me to understand exactly what it must have felt like. And so thank you for sharing your story. And we'll now
No problem. Thank you for having me.
Thanks. And we'll now hear from Jess.
Hi, good afternoon, everyone. And good evening, sorry, it's that late already. So thank you very much for inviting me to talk this evening. I'm going to talk today this evening about my perspective from my perspective as a frontline healthcare worker, a consultant in respiratory medicine, and I'm going to speak as someone who also campaigns for the healthcare access rights of people who are not born in the UK. I want to start by talking about what we mean by healthcare access, and how that was experienced pre-pandemic, and then what the impact of the pandemic has been, and perhaps end with some actions. It was really fascinating hearing the last two talks and the mobilization within the communities that Ali and Hakk live in, Hakk's mobilization himself and his experiences of asylum. And I just want to talk a little bit about the background to this in relation to history. But first of all, healthcare access. I think before we understand how to reduce barriers to accessing care or even other services, we need to understand the concept of healthcare access. All too often it's positioned simply as a gateway that must be crossed, but that's far too simplistic. How we access healthcare is a complex social process shaped by our own identities, our capabilities, our social networks, our social positioning, and their intersection with what I like to call the healthcare arena, the people, the policies, the buildings, and the geographies of health services. And by health service, I mean broadly conceived, not just the NHS, but perhaps the health advice you get online, the pharmacies, the people that you talk to about your health. And really importantly, your experience yesterday shapes your interaction tomorrow. And that's why history and context are important to understand. Ali said that it felt like the government was sending a message that you're not welcome here. And that's exactly what they are doing. In 2012, Theresa May, then Home Secretary, announced a series of policies aimed at making life really difficult for people living in the UK at this time without the legal right to do so. Now, Hakk explained that he's an asylum seeker, but these policies were anti-immigrant broadly. They were wide-reaching, and they didn't just include restricting healthcare access, but also restricted access to housing, to banking, to schools as well. And that's important because health outcomes are determined not only by what happens to you when you go to see the doctor, but the conditions in which you live, which shape whether or not you're likely to go and see the doctor. So housing, poverty, and how society positions you, race, class, gender, immigration status, all have an impact. Over the past 2 decades, an NHS in crisis and increasing concerns represented in the media and public discourse around immigration have been conflated, and that has led to increasingly restrictive policies relating to healthcare access for overseas visitors and migrants. The issue of people coming to the UK to use the NHS was highlighted by Now Bevan, and I know that Hakk works for Bevan Healthcare, but we all understand Now Bevan as the founding father of the NHS, really, and he talked about concerns around having a health service open to everyone. And he said at the time that it would be unwise as well as mean to restrict access. And he cited the fact that anyone coming to the UK contributes to the UK economy, whether it's through consumptive taxes or income tax. Everyone who is living here is contributing, and visitors contribute as well. And that it would be unwise because we should look after our communities, essentially, and the people living in them. Over the years, successive groups of people have been excluded from free access to the NHS, beginning initially with undocumented migrants, then failed asylum seekers, and most recently students and workers on visas who must pay the immigration health surcharge, a bill that quickly runs into thousands and thousands of pounds for a family of 4 on a 5-year visa, for example. When I first started working in the NHS well over a decade ago, I knew nothing of the NHS charging regulations. Although they did exist, they were not implemented. And there's a number of reasons for that. The bureaucracy of implementing the system cost more than was actually recouped. According to the government's own analysis, the largest group of chargeable people were the least able to pay. In response, the 2015 charging regulations increased what we could charge people from 100% of the cost of, let's say, a cesarean section, just because I had one of those about 6 months ago, which would be about £15,000, to 150% of cost. So that's £22,500. And I don't know about any of you, but I would really struggle to pay that. Certainly, the vast majority in the UK do not have that kind of money sat around. And I would say I'm in a well-paid group of people. There was also not the appetite to charge people. it went against the founding principles of the NHS, healthcare free at the point of service based on need and not ability to pay. And so there had to be some disciplinary notions. Sanctions were introduced, and they were threatened to NHS trusts who did not identify and charge people. And a disciplinary tone in the charging regulations implementation guide talks about fraud. Indeed, I've worked for NHS trusts who have placed the idea of patient fraud, so people coming to seek healthcare from the NHS when they're not entitled to do so, or even other people working in the NHS facilitating their access, alongside discussions about fraud committed by consultants who use NHS time for private work. And to me, that is pretty disgusting, to put those two things next to each other. People who are asking for help when they're unwell, and other people abusing a system who are in a privileged position. Underpinning these legal changes in policy documents is this notion of fairness. And importantly, this is positioned as fairness to the British taxpayer, leading to, I think, questions about how British citizens who don't pay tax are actually considered. So people, for example, who cannot work due to disability, or who are homeless and not working. And also what we think about in terms of fairness on a global scale when we consider the impacts and harms of colonialism. So then in 2017, for the first time, legislation was introduced which allowed the NHS to refuse to provide treatment in lieu of payment for any condition considered non-urgency. And urgency depended upon when you were likely to return home and how quickly your illness might cause you to deteriorate. Well, we've heard from Hakk how long he's been in the asylum system, and many people who have been living in the UK undocumented, or whose asylum claim has failed, would be chargeable for care. But we don't know when they might return to what the UK government positions as their home, but they actually may position the UK as their home. And that means that dangerous decisions can be made and care can be withheld, and that can result in death. Sylvester Marshall, along with many others from the Windrush generation, had treatment denied in lieu of bills running into thousands of pounds, which he couldn't pay. He was racialised as foreign, but was in fact a British citizen. Kalima Mulat, a refugee fleeing political violence in Ethiopia, had a life-prolonging cancer treatment denied. And Asayas Welde was an asylum seeker from Eritrea, who's now been granted leave to remain, but was discharged to the street because he could not pay the £33,000 for life-saving cancer treatment. It took campaign groups a long time to support these people, and then also to argue that care for pregnant women should never be withheld. But there is still a hierarchy there, because termination of pregnancy is chargeable and can be withheld because it's considered non-urgent. And there is a two-tier system with people who pay the immigration health surcharge, who are not entitled to fertility treatment. So even if you are granted leave to remain and have to pay a visa here, you're still not treated the same as British citizens. And then came the pandemic. So we've heard a lot about how the pandemic shut people in, and it shut people out of healthcare services as well. People were afraid before, people who were not born in the UK were afraid before of accessing healthcare services, but that was compounded then by fear of contracting a deadly disease by seeking help, and that the information that infection was disproportionately borne by people of colour came out over time. One particular story or experience that was revealed was a Filipino man who had lived in the UK for 10 years, and he had been too afraid to seek help because of this hostile environment that existed. And he died at home from his COVID. So these fears are not some policy, some existential fear, that they're real and they have real consequences. In my clinic, I've experienced a lot of digital exclusion, which Ali talks about. We've had to rely a lot on phone interpreters, and we haven't had face-to-face interpreters. If you don't trust very easily and justifiably, understandably so, then speaking to someone over the phone can be quite tricky. And getting hold of those interpreters because of funding cuts has also been really difficult. And healthcare access is based on a foundation of trust. If I cannot communicate with someone, then I can't build that trust with them. I can't provide adequate care. I can't treat them properly. There's also been an impact because of this there's a rising cost of living and furlough and people in insecure jobs, and all of that has a further impact on their health. And then when we think about what we can do to challenge these things, our ability to organize, our ability to resist, our ability to protest was also hampered by the pandemic, because we couldn't get together in spaces, and people who struggled to access digital platforms could not take part. There are some examples where actually it's been easier. So this evening, it's easier for me to talk here this evening. I've got a little baby downstairs, so doing the Zoom and not having to leave my house is helpful. So I don't think everything has been bad in terms of the changes of the pandemic. There's been a greater understanding of the importance of public health following the pandemic, and public health means providing healthcare to everyone who lives in our community, not just some people. And I think that that's been really important. And we've seen that play out in terms of access to vaccinations. There's been a huge drive to get everyone vaccinated, including, just today in my local borough, Haringey, there was a event to vaccinate anyone who was undocumented. You didn't need any sort of identification. You didn't need to provide any information. They didn't have any authorities present. And I think that wouldn't have come about had we not had the pandemic. And I just don't want to go backwards now. I think we need to dismantle the hostile environment. And one of the first things we need to do in relation to healthcare is scrap the NHS charging regulations. We also need a firewall between the health service and between the Home Office. No information should be passed from the health service to the Home Office ever, because we must protect confidentiality so that people, when they're unwell, feel free to be able to come and be cared for. And that's why I'm part of a network of grassroots organisations that campaign for patients, not passports, and are demanding all of these different things to change. And I think that it's vital not only to ensure the welfare, safety and save lives of individual people, but it also protects our communities. And it protects healthcare workers, because healthcare workers do not want to restrict their resource. We do not want to differentiate between one person and another simply because of where they were born. So I'm going to end there.
Wow, thank you so much, Jess, for such a very, very powerful account. You spoke about, the path that was taken to actually get here in the first place. And you actually explained what is meant by access to healthcare. And thank you for sharing the stories of, the various patients that you mentioned. And we really got a clear understanding of how the NHS has been used as a weapon for xenophobia, really, and anti-immigration in our society. Thank you for the work that you continue to do with your activism as well. We'll be now moving to a time of questions and answers. So this is a time where the audience can bring forward their questions, but also the panelists can bring questions to each other, and we can get a conversation flowing in the time that we have left. So I wanted to start off with a question that's put forward for Ali. Ali, based upon your experience, what can local governments do to support the operations of community organizations like yours?
Thank you for the question. I think there's a lot of things that can be done from the local authorities, supporting these people. As we talk about hostile environment and people, feeling fear of scaring about representing themselves. There's a lot of barrier around, and that is a big problem. My concern is about what we can call as hidden communities. If you talk about the system, the asylum system is very tough, and a lot of people get in very quickly a decision, especially those negative decisions. And most of them now, they hide themselves because they're scared about the system and be deported. What we call destitute asylum seekers, especially during the lockdown. They used to be hosted by refugee communities, especially from the same country. And when the COVID comes, there's a lot of difficulties because people escape from each other who is getting the COVID. And some of them, they just escaping rough. And there is some big difficulties for those people. I think the government, they should support these people. At least they can get accommodation and getting support regardless of their status. And it is really hard to see these people begging hot food once a week in churches. That is a big thing. And I think the government, they know those people. And if you ask them to sign every 2 weeks, they just are hiding themselves because they don't want to sign because they will be caught and sending back homes. So this is one of the things I think the government, they can do. How do you feel in the Great Britain, people begging food? And this can be like a normal culture of people facing this. So I think the government and the local authorities, fortunately, I think Leeds is a bit doing some effort, but it's not enough for those people. And now they stop any support. In the past, they are having church and the third sector supporting people. And you see the government and the local authorities just looking at these people and seeing that if there is any other donations from individuals or the churches or the other organizations is enough. It's not enough. I think they can do more. And the local authorities, they can find accommodation for these people, supporting them healthy, staying healthy and safe. And all these things is not, we haven't seen them now. We try to support these people. We're running what we call the hardship fund. We just give people some money. If I can say one of the stories, one of the women, she said she normally buy a day ride ticket to stay in the bus for more than 5 or 6 hours because this is the warmest place that she can stay in. So this is one of the stories. I know the people, they know it, and they're struggling to challenge this hostile environment for this. But there's a lot of stories. People now more than 12 years, 18 years, they don't have a status and nobody knows them. They're being exploited by working for £2 an hour, cleaning or doing other stuff. So this is the situation, and I think the government knows, and the local authorities, they know also what is going on. But everyone, he just washing hands and seeing that is going on. This is what happening. I think at least they can get in some support by giving small money, supporting people, and then leave them to the state sector and the churches and the individuals to support these people. Thank you.
Yeah, thank you so much for sharing. It's clearly a structural issue that shouldn't be left to the voluntary sector and the third sector, the NGO sector, to deal with. Thank you so much for your contribution. I would like to open up the floor to any of the speakers to provide any questions that you may have for each other.
Can I just ask a quick question to Dr. Jess, please? Just as I am also working in the GP practice, so we are advocating, everybody has right to health, and you just mentioned that, I think governments should put a firewall between home office and the, NHS, because people are really afraid of going to GP because they might get a radar. So like you gave an example of a Filipino gentleman, passed away in the house. So is there any legal, is there any law that people have rights to health, or it is just still in the limbo?
Such an important question, and I was actually talking to a series of junior doctors about this very question: is there a right to health? The right to health is really complicated. There is a human right to health, but it's not realized very well. And one of the reasons behind that is that it's positioned as not immediately realizable. So you can immediately realize someone's right to freedom from torture by not one, torturing them, or two, providing asylum to spare them from torture. But making someone or providing health is not just a one-off action. And so it's positioned as something that's potentially realizable, and it's framed as within the resources of that a government has. And that's where this idea of fairness comes in, fairness to the British taxpayer, because there's an argument that there is not a finite amount of resources, and therefore we have to consider what healthcare we provide and what levels of healthcare. And in addition, the government and government policies ask, whom should we provide healthcare to? And that to me is problematic. And I think it does undermine the right to health, the notion that there is a right to health. There is in this country a right to access primary care for free for everyone, and similarly A&E. And there is a bit of legislation that writes that down. There's a very useful leaflet that I often kind of quickly Google and print out that makes you have to tick a box to say why you're refusing to register someone and if you're going to a GP. But it's very difficult to advocate for yourself if you don't speak the language. I've been with people trying to register with GPs, and it is not easy. And primary care is under a huge amount of strain at the moment because they are having to manage more and more patients with less and less resource. And so they are drawing barriers which should not be, in my opinion, drawn, or in places where they shouldn't be drawn. And that's around groups of people.
Yeah, I totally agree with you. Yes, thank you very much.
There is a right to health, but it's very complicated, not easily enacted.
I know what you mean, yeah. Thank you.
Does anybody else have any questions? Jess?
Yeah, I had a question actually about Ali, you talked about volunteering, and that gave you some meaning. I guess my question is it really volunteering if you're not allowed to work? so you've been when you're in the UK for the first year and you're not allowed to work as an asylum seeker. I find that such a difficult thing to understand, why the government would have such a policy, and the harm it did to you, not being able to provide in a way that you've provided before, not getting meaning from your job, and so you took to volunteering. But I find it difficult to describe it as volunteering when you had no other choice.
Is a question for me, Jess?
Yes.
Yeah. All right. Sorry. Normally you have a right to do anything, actually, but for volunteering, you are allowed to do anything you like. But when it comes to the working in a place where you like, it is banned, really. And also, even though you waited one year as an asylum seeker, you will be granted with the work permit, which is restricted area. So you can't really work. If you are a teacher, you can't really work in a school because you haven't entitled with a refugee status. Volunteering, I think they have no issue with it. So I think and also I got this job today with the volunteering opportunity, because there was a project called Ships in Bevan Healthcare, and I applied for the position, and I was selected one of the volunteer, and then we started, and the project's actually objective was to bring people with the live experience of like asylum seekers or refugee or homeless background, to bring them life again. So it basically gave us opportunity to learn new skills like mandatory trainings in the NHS. It was really useful. Otherwise, I think I will drive me crazy. So it is really hard, as you can't really move around. So yeah, it really helped me to be one of the volunteer in the NHS organization. Yeah, I don't know if I answer your question, just sorry.
No, it's okay. Interesting, you talked about moving around, because I've had that problem with some of my patients that I treat for tuberculosis, where one day I'm looking after someone for a 6-month course of treatment, and the next day the Home Office has moved them to the other side of the country with no communication with me, no thought to what the impact of their treatment might be, and I find that very frustrating.
Oh yeah, definitely. Yeah,
like from their perspective, obviously that provides is not great care, but even more disruptive for the person who's experiencing it, of course.
Yeah, you always live in a limbo, so you don't know when and where they're gonna move you. But once you settle down in a house accommodation, home office accommodation, then yeah, it might be a bit clear where you're gonna be for the next couple of years. But yeah. Thank you for your question, Jess.
Yeah, if I can add a bit about this.
Sure.
I think that's a big issue, because there are a lot of even refugees before or after they got their status, they have qualifications back home, but they're struggling for years to get the right work matching their experience here in this country. I know PhD holders. One of the PhD holders is working as a security in the job center. So that is one of the things. So I think the government, during the recessions or during the last 10 years, they tried to replace people by volunteers, even cuts and lack of funds and things like that, and moving all these skills to the sector and the voluntary sector. So that is what's happening now. This is why we as an organization, we're struggling to get staff coordinating the work. We totally rely on volunteers. We are 5 staff, and we have 72 volunteers running the activities. So that is what's happening. And sometimes you're struggling even to pay the travel expenses. So that's the situation. And we don't know where we get us in the future. If you want to serve people and wash your hands, don't do anything and supporting these communities. And you see also some of the volunteers, they're just spending time, and there is a lot of mental issues around this. We're spending time and no any other solutions for those people, and they are young. If you're talking about 30, 32, 34, 36, 40 years old, and this is in this dilemma. So how that can be resolved? And I think there is a lot of effort and campaigning around different issues just to put the things in the right track, how they can support themselves.
And how dependent your vital organization is on volunteers is coming into this phase where cost of living is just, skyrocketing with the war in the Ukraine and the post-pandemic recovery. How are organizations like yourself going to survive, and you're providing such a vital service? That's really worrying for me.
Yes, thank you all for contributing tonight. This has been a huge eye-opener about, I guess, the shadow side of the labor market that we have here in the UK, and how it's been shaped by the experience of migrants during the pandemic. I, for one, think that if you have no choice but to volunteer, I think it's no longer called volunteering. I think it's softly coerced slave labor. That's what I think. It no longer has the title of volunteering, because I'm so sorry. Volunteering, you volunteer by choice. If you're forced to volunteer, it's no longer volunteering. And so this is a huge eye-opener on how the labour market has shifted, what rights look like and access to basic needs and health looks like to migrant communities, and also how local organisations like the Leeds Refugee Forum have had to deal with the burden that should be on central government. Thank you so much, Dr. Jessica Potter, Ali Mahgoub, and Hakk Ozal, for contributing so powerfully to today's panel and for providing such a very insightful discussion as well. Gave us a lot to think about, and I do hope that things look up and there'll be a resulting policy paper that comes off the back of this panel. So thank you very much for all contributing to that, and thank you to our viewers on YouTube who have sent so much love to the panelists. Hakk, you have so many fans. Wow. Everybody wishes you all the best. Thank you for your time, for your hard work during the pandemic, and for your perseverance for fighting for the rights of migrants and refugees, Dr. Jess. So thank you all for coming, and have a good night.
Thank you very much. Bye.
Well, thank you so much. Thank you.
Thank you. Bye.
Thank you. Okay, I think that's us done. Thank you so much, Mohammed. Oh.